this urgent debate because people who need public health services are suffering with the closure of a major specialist hospital in the middle of a raging epidemic. The fire that caused this closure happened 2 months ago. We've had various promises at various times that sections of the hospital that were undamaged would be reopened, but this has not happened. We all understand the need to comply with safety standards, but it is simply a matter of priorities. The technical issue should either be resolved speedily or exemption obtained using emergency powers or state of disaster legislation. I do have to agree with the chairperson of the Parliamentary Portfolio Committee on Health, Dr. Sibongiseni Dlomo, who said in a statement as follows. Dr. Dlomo said, "It will be practically impossible for the province to manage the third wave without the more than 1,000 beds, which is inclusive of 124 intensive care unit beds at Charlotte Maxeke Hospital." Now, patients from Charlotte Maxeke are currently in hospitals around the province, crowding them even more as COVID-19 cases flood in. It's really getting to be, I get reports all the time, and I'm sure the Honourable MEC is, it's getting to be very, very tight at our hospitals. Now, specifically, cancer patients have had their treatment disrupted, and dialysis patients have to travel to Helen Joseph Hospital. Linda Greef of the Cancer Alliance, which is a lobby group, says that, quote, "The cancer crisis can be equated to life for Sedimeni. This is indeed a violation of basic human rights." And she's referring to the fact that any delay in cancer treatment is life imperiling. And there really has been disruption of cancer treatment. I know they've done their best to have chemotherapy at Chris Hani Baragwanath and radiation therapy at Steve Biko, but it's really not enough for these patients. Now, just an example, this morning I got a call from a kidney dialysis patient. She told me she spends the whole day at Helen Joseph Hospital and she only gets back home at 1 in the morning because they use the dialysis machines at night. And there's transport difficulties as well getting to Helen Joseph Hospital. And I get constant calls from patients who can't easily get their medicine from another health facility. It's just not always that easy. Now, we are told that the delay is because the Johannesburg Metro Council wants the original building plans, which I don't think they ever had. They want fire evacuation routes, and they want compliant fire doors. A doctor, he told me that they're even quibbling about the correct exit signs. You know, I'm really puzzled as to why the Johannesburg Metro Council is now insisting on measures that it did not insist on before when they supposedly did fire safety checks. They're supposed to have done this every year. If they'd done them properly, we probably would not have had the fire at this hospital. And the question is, why were the fire doors not upgraded long ago if they were so unsuitable? And I'm sorry to say, this is what happens with years of poor maintenance and non-compliance with basic safety standards. And unfortunately, I have to observe that the same incompetence is delaying the reopening of this hospital. And seriously, why can't a firm date be given even now? I'm asking the Honourable MEC, can she tell us Tuesday next week, as she sort of said yesterday, hopefully, which sections are going to be reopened? I think we need a timeline, but I don't think we need a timeline, actually. I think just it should be open next week. Whatever needs to be done needs to be done. The urgent need is now, because unfortunately this is definitely costing lives. Now finally, we've all heard in debates that this year has been proclaimed as a year of Charlotte Maxeke, and she's a truly worthy woman, Charlotte Maxeke. I truly believe so. But don't you all think that it's a disgrace the hospital that bears her name is abandoned as we speak? The wards are empty, equipment is lying idle, and the staff are dispersed all over the province. Doctors are pleading for the hospital to reopen as they worry about the lives of their suffering patients. Does anybody in this legislature believe that this hospital still honors the name of Charlotte Maxeke? It's really a very sad question to ask. I really just plead today, surely this provincial government can do better than this, and please try and reopen this hospital safely as soon as possible. Thank you.